a moment just to, oh, it's already recording. Great, thank you. I'd like to start by introducing you to the CCE Sullivan team. Your narrator today will be Wanda Cruz, our Healthy Communities Program Coordinator. Thank you so much, Wanda, for putting today's program together along with our partners who are here with us. Program Director Melinda Ware will assist in facilitating the chat box, and you can enter questions and comments throughout today's presentation. At the end of each presentation, if there are questions, Melinda will present them for answers and feedback from our speakers. And assisting with moving through the PowerPoint slides is Operations Coordinator Erin Denman. Thank you, Erin, for helping us out today. Next slide, I believe. Before we get started, I'd like to thank our partners and sponsors. Those organizations include America Walks, the Sullivan County Department of Planning and Community Development, Sullivan 180, the Federal Highway Administration, Cornell Local Roads Program, New York State Department of Health, Creating Healthy Schools and Communities, and the Physical Activity and Nutrition Center of Excellence. And to get us started with the funding for Safe Routes Web Conference, Healthy Communities Program Coordinator, Wanda Cruz.
Thank you, Colleen, and welcome all. Today, we hope to share with you as much information as possible to assist in successfully funding and applying for funding to support safe routes policies and projects in your local communities. We hope the information you glean will help you put together competitive applications that will bring infrastructure resources into Sullivan County. You'll receive a post-conference packet by email with today's presentation, additional background information from our speakers, question and answered, and follow-up resources you can use to craft your funding application. Today, you'll hear from Dr. Ian Thomas, State and Local Program Director of America Walks, Freda Eisenberg, Commissioner of Planning and Community Development for Sullivan County, Amanda Landsater, Manager Director, and Shannon Salento, Community Development Program Manager at Sullivan 180. Dr. David P. Orr, PE and Director of Cornell University Local Roads Program, and Dr. Hillary Eisbrands, PE Team Leader and Senior Road Safety Engineering with the Federal Highway Administration Resource Center and Safety Design Team. To start us off, we have Dr. Ian Thomas, State and Local Program Director of America Walks. Ian develops and delivers educational program for advocates, professionals, and elected officials about the benefits of walkable communities and strategies to create them. Thank you, Dr. Thomas. Take the floor. The floor is yours. You're muted. Ian, you're muted. Okay.
Thank you.
You're welcome.
Thank you, Wanda, and good morning, everybody. Really great to be here. Obviously challenged by the technology already. Let me see if I can share my screen. Can you see my opening slide there? Awesome. I see some nods. All right. Well, thank you. So I'm going to be talking about activity-friendly routes to parks, schools, and other everyday destinations. And I'm going to start off with a little introduction to the organization I work for, America Walks, and then talk about these two frameworks, which I'm sure you're familiar with, Safe Routes to Parks and Safe Routes to School, and expand that to this idea that every community should be designed with activity-friendly routes to everyday destinations, and dig into what I mean by that and how that supports healthy physical activity in every community. Now, how do we get there? How do we turn some of the road corridors we currently have, which are unsafe and not friendly for physical activity, into those activity-friendly routes that go to those everyday destinations? And I'll argue that the first step is to organize a community walkability audit. And I dare say some of you have been involved in walkability audits. And I'll talk about how that can then lead to effective advocacy for change and give some tips on funding and resources, although I think there are other speakers here today who have more detailed information about the funding in particular. So Wanda, we had talked yesterday about possibly doing a poll were you able to prepare the polls that I suggested? Ah, there we go. Wonderful. So I'm just interested to know the background of everybody on the call. So if you could each just sort of fill out this poll question, and then I guess Wanda, at a certain point when everybody or almost everybody's done it, you'll press a button, and or maybe it's Erin, press a button, and there'll be and we'll see what that sort of distribution is among these different fields. So while you're doing that, I will move on to the first section that I've prepared here and talk a little bit about America Walks. So we are a national education and advocacy organization. We're focused on encouraging people to walk, but we realize that the way to do that is to create walkable communities, which is more of a policy systems and environment approach. A lot of our work is in terms of communication and education. We have about 32,000 subscribers all across the United States who receive our email newsletters, participate in social media conversations, attend our webinars, which are free, and we continue to keep a conversation going about the benefits of walkable communities and how to create them. We think of our work in these two buckets: advancing safe, equitable, accessible, and enjoyable places to walk and move, by giving people and communities the resources to effectively advocate for change. And those arrows are intended to indicate that as people engage in walking activities, they then see the value of then becoming an advocate for change, calling for change, being part of a local movement. And when that local movement is successful and we see change, then we create more safe, equitable, accessible, and enjoyable places to walk. Let me just pause for a minute. Do we have the results of that poll? There we go. Wonderful. Oh, well, quite a distribution there with every one of those categories represented apart from social services, and the majority in public health, planning and transportation, and education and research. Great. Well, that's really helpful for me. Thank you. So what does a walkable community look like? And I'm just, I find Zoom a little challenging sometimes because there's a bar that blocks some part of my own slides. So these are some illustrations of what we think of as walkable communities at America Walks. They can be urban communities, they can be suburban areas, although that's one of the most difficult areas to refit as a walkable community, or they can be in rural America. But we certainly don't focus only on one setting. One of the strategies we used, as I mentioned, is our webinar series. Once or twice a month, we put on a free webinar. Some typical titles are listed here. If you are not already receiving America Walks emails, please go to americawalks.org and just sign up there. You'll get all the announcements about the webinars. Funnily enough, just yesterday, we did a webinar on walk audits, and that will be up on our website as a recording if you would like to go back and catch that. And I'll be talking about walk audits in this presentation as well. We have a program called the Walking College. This is much more of an in-depth training. We award a limited number of fellowships every year, about 25 to 30 for our national walking college. We are also doing state walking colleges in certain states, not New York this year, although we did one several years ago in New York State. These fellows commit to working 5 to 10 hours per week over a 6-month period. It's all online, or at least it is now. Before the pandemic, we would bring everybody together for a physical convening, and we haven't done that the last few years. And they work through 6 modules around how to be an effective walkable community advocate. At the end of that course, they write their own personal walking action plan, and we then continue to support them as they implement that plan and achieve new programs, new organizations, communication events or campaigns, policy change, and ultimately built environment change to make their community more walkable. We have also held several national walking summits. Again, the pandemic has kind of interfered with those plans. This was the most recent one, and you might recognize that date of March 2020. It was literally, the pandemic was coming. I think everybody knew it was coming. Nobody knew exactly what it was going to look like. We did make a serious consideration as to whether we should cancel it or not, made the decision to go ahead just a few days before. Quite a lot of people decided not to come. I think our registration was down about a third, about 2/3 of people actually attended in St. Louis. We did put in place, some precautions, and I'm not aware that anybody got sick as a result of it. But we would like to do more national walking summits where we can bring together hundreds of advocates from across the country to share best practices, to network, build relationships, and foster the national walking movement. So I want to move on and talk about these two particular frameworks, Safe Routes to Parks and Safe Routes to School. And the reason we want to look at safety is because it is such a critical issue for walking and walkability. This shows the number of pedestrian deaths each year for the last 11 or 12 years. And you can see it is just going up and up. That number has increased by more than 60% over the last decade. And even more surprising, during the pandemic years, 2020 and 2021, there was far less driving. We're all very much aware of that. Vehicle miles traveled across the United States dipped substantially as people initially were in lockdown and then working from home. And the amount of driving that's happening in the United States has continued to be below pre-pandemic levels. And you might have thought, well, if there's less driving, that's the thing that causes pedestrian fatalities. But pedestrian fatalities have increased substantially these last 2 years. And the research shows that the reduction in the number of cars on the road actually has a negative effect on pedestrian safety because people are going faster. So there's a really important lesson here. Transportation professionals and planning professionals very often feel like it's really important to widen roads, add lanes in order to alleviate traffic congestion. But that traffic congestion actually makes the roads safer as the vehicle speeds are down. And when we have fewer vehicles on the road, people are driving faster and people are dying, being hit by cars while walking. So we have these two frameworks around safety for walking. Safe Routes to School was established in the mid-2000s. It consists of a lot of different components. We can have walk to school days, which is always a fun way to start a Safe Routes to School effort. Takes a certain amount of coordination, organization, partnership, planning, communications, but the kids love it. And you can invite, celebrities along or mascots from the local college or local officials to be part of it. It's all a really good way to draw attention to the importance of safety while walking to school and to identify issues with certain roads around schools. The walking school bus, that picture top right, is kind of institutionalizing the walk to school day, making it an everyday event, having a specific route that a couple of adult volunteers walk every day, picking the children up either at their homes or at neighborhood meeting points and all walking together to school and then home again in the evening. It's a very visible program in the community because it happens every day, and it can really cause decision makers to reassess how transportation dollars should be spent, how roads should be maybe redesigned to make them more walkable and safer. It has a tremendously positive benefit at the schools where the kids have had that physical activity in the morning and are really ready to settle down and participate well and learn as is the purpose of public education. Bicycling to school is a really great mode, particularly for middle schoolers. So there are different kids education programs to teach them not just bike handling skills, but the rules of the road and how to interact with vehicles. And then talking about the roads, we have a lot of unsafe situations, even around schools. So this lower right picture shows an example of how you can redesign an intersection close to a school entrance to slow all the vehicles down so that kids walking and biking to that school are really safe. And bulb outs and brightly painted crosswalks are a great technique. The Safe Routes Partnership is the sort of lead national organization that promotes and supports and tracks walking and biking to school and to other destinations like parks. And they've produced this fact sheet which shows all of these different benefits that come when more kids are walking and biking to school. And I'm just going to focus on a couple of them. We expect to see healthier students. This graph shows that over the last 50 years or so, the number or the percentage of US children who walk or bike to school has dropped substantially. And over that same time period, the percentage of overweight and obese children has greatly increased. And there's certainly some kind of connection between those two things. And we know that if we can get millions of American children walking or biking to school, that their health will improve, their population weight will be lower, and we'll have a healthier generation growing up. Traffic safety. This graph shows the likelihood that a pedestrian hit by a vehicle at a certain speed will be killed or seriously injured. And again, you can see that at those lower speeds, this is the data proving that we want lower speeds, especially around schools, but anywhere where we are hoping that people will be walking and biking, so that if somebody makes an error of judgment and there is a collision, it's a low speed collision and the person in the vulnerable condition is not seriously injured or killed. And cost savings. If we can build a community around walking and biking to school and throughout the community, people are going to save money. It costs $9,000 per year on average to own and operate a vehicle in the United States. And by creating an activity-friendly community, activity-friendly routes to school, then many of those households that have two vehicles can drop down to one vehicle. And if they're the average household, then they're saving $9,000 a year by doing that. Some one vehicle families may be able to go car-free. And the other thing that I love about Safe Routes to School is how much the kids enjoy it. And you can just see on this photograph that those kids on the sidewalk heading to school are having a great morning. I don't think the same would be true for the ones in the SUV. And I think, Erin, I had another poll question here asking about whether participants have engaged in Safe Routes to School or Safe Routes to Parks projects. So maybe if you could all just select one of those, Safe Routes to School, Safe Routes to Park, both or neither, that would be really helpful. And I'll go on a few slides and then Erin ask you to share the results. Let's see. Yeah, so Safe Routes to Parks is a more recent framework that's been developed by the Safe Routes Partnership and the National Parks and Recreation Association, I believe. I apologize if I have that slightly wrong. And it takes the lessons learned with Safe Routes to School and expands those to Safe Routes to Parks. So again, there's a whole framework about how communities can focus on the locations of their parks, the conditions within the parks, the conditions on the roads connecting to the parks and the roads going around the parks, and make parks more safely accessible to everybody using this framework of assess, plan, implement, sustain, all the while engaging with the community around the parks and then implementing those changes that improve safety and improve access. So Erin, could you maybe share the results of that poll about safe routes to school and safe routes to parks? Okay, so this sounds like something that more than 50% of participants have not been involved with. So I would encourage you to start with a Safe Routes to School project. Start with a walk to school day with the kids. There's lots of resources at the Safe Routes Partnership website, and just Googling around about how to do that. Thousands and thousands of schools have done walk to school days, and it's a really great way to start more of a sustained program. I facilitated a panel discussion for the Creating Healthy Schools and Communities program just a month or so ago, early January. And Wanda, I think you were probably at that event, Wanda and Melinda. If you could share with everybody the link to that recording, then it'll be a great resource for people to hear about how different parts, how Safe Routes School projects in New York State and elsewhere in the country have gone ahead. Did you want to jump in with something there, Wanda? Oh, I'm not hearing you.
I'm sorry. No, you're doing great. Thank you, Ian.
Okay. All right. So safe routes to parks, safe routes to school. Why not make safe routes throughout the community, all the everyday destinations that people need to get to? And that's where I'm going to focus now, is how to make your community safe and activity friendly. So here is a sort of an aerial street network, an aerial view of a street network in a typical community. All of those dark hard lines coming together, those are high-speed highways. There's obviously an interchange there down at the bottom, and then there's a network of maybe older neighborhoods with the neighborhood streets there. So let's just look at somebody who lives here at this in this neighborhood called Castleberry Hill, and think about what are those everyday destinations that the people, the family that lives in that house might want to get to. Well, we already talked about schools and the clear benefits if children are able to walk to schools, and public spaces and public parks. Again, that is a place that you go to exercise, so it doesn't make sense to drive there and then do it. If you could walk, and if it's a short distance, you get exercise on the journey as well as when you're at the park. But then people need to go to work. So these are other destinations, office buildings, factories, different workplaces that people need to get to on a daily basis. People need to go shopping. So there's the supermarket. People may need to get to a pharmacy or to healthcare appointments. So again, we have this growing sort of network of routes that we want to be safe in order for people to get to everyday destinations. Then there's entertainment, restaurants, as well as getting to public transit, so that if you're traveling further than you can walk, then you can do so without using a car, without putting another vehicle on the road that's going to make conditions unsafe for somebody else, or at least when multiple people are using public transport, then there are fewer additional vehicles on the road, and you can still get to a neighboring town or village or a distant part of the city that you live in. So let's flip over now and look at the activity-friendly routes themselves. What exactly are we talking about? Well, we might be talking about bike lanes on the main streets, or trails that are actually off the streets. We're certainly talking about sidewalks on every street and crosswalks frequently enough that when somebody needs to cross the street, they can do so and don't have to walk a long way out of their way to find a safe place to cross, which is the case in so many cities. We want low traffic speeds, and we prefer lower traffic volumes, so that it's an enjoyable and safe experience walking along that sidewalk, crossing the street on that crosswalk. It's really a better walking experience if there are interesting buildings, not vast parking lots to walk alongside. Nobody likes walking past an enormous parking lot, but walking through a downtown street with older buildings or just architecturally designed buildings can be a wonderful experience. Part of that aesthetic experience is having trees and landscaping there. And it's also important that the distances are not too great. And that is one of the biggest problems that has to be solved to create walkable communities, because what has happened in the last 60 to 80 years as communities have developed in the mid to late 20th century is they've developed around a car mobility model where things are far apart. So it might be that your child's school is 4 miles away, so they really can't walk to school. It might be that the nearest grocery store is too far, or the place that you work. So changing those distances, that is a land use planning and redevelopment problem, and changing building codes so that buildings can be closer together, so that different uses can be in the same neighborhood: residential, retail, restaurants, employment, office, schools, public space, having that mix of uses. And as communities redevelop, looking to develop more compactly and reduce reliance on the automobile is that, big picture, long-term process of creating more walkable communities. Now let's have a look at what some of these activity-friendly routes look like. They may be walking trails that are off the road or only have, parked vehicles in. They may be going through natural areas. Bike trails and walking and biking generally work well together on the same trail. Where we're crossing roads, let's have safe crosswalks, central pedestrian refuge islands there, which both give the pedestrians a safe place to wait and create narrower openings as vehicles are approaching, so they instinctively slow down. And then if there's a pedestrian waiting to cross, they will be willing to yield and allow that pedestrian to cross. And downtown streets, main streets with lots of businesses and restaurants and street furniture, landscaping, and so on, so that's an engaging place that people want to be. By the way, this kind of street design is much more prosperous for locally owned businesses than the car-oriented sprawl, which tends to be owned and profiteered by large corporations, kind of pulling the money out of the community instead of reinvesting it, as is the case with more downtown locally owned type businesses. Unfortunately, this is the exception in most American cities, and the rule is business districts, business loops that look like this, with multiple traffic lanes, the business buildings themselves set way back from the road behind parking lots, a lot of cars moving everywhere, a very unsafe and unappealing place for pedestrians. Here's another example. Literally, people have to, walk to work like this, along a highway like this, have to get across a highway like that. Very, very unsafe. There are places where people need to cross where they would have to walk half a mile out of their way to get to the next interchange. And even there, the conditions are not safe for crossing anyway. So people just do the best they can. This is a real picture of a real location in the city of Denver, where there's an interstate highway going across the top. There's another major highway going underneath. There's no sidewalk. On one side is a low-income housing development, and on the other side are fast food restaurants and hotels where the people who live in the housing development work. And this was a walking route to work for many people in that part of Denver. This is an old photograph that, as a result of advocacy by groups down in Denver, this bridge has been completely redesigned, and there is now a safe walkway connecting that housing project to those businesses. So here is another bleak looking road where you can imagine vehicles are going to go very fast. But I want to just give you a few examples, and this is the first, of how that can change relatively inexpensively and make it look very different. So imagine you're a driver, how you might kind of, drive along this road the way it looks. But how about if it looked like that? Don't you think you would slow down with that, some trees, some textured paving, the crosswalk there, and all of that, of course, attracts people who want to walk because it's now a nice place to walk. Here's another example. Clearly a high-speed street. That car coming towards us is going to be kind of hitting the gas because that's what you do when the road and the corridor and the buildings look like this. But how about now? That is the same street with some graphical elements added. That same car is there. It's just kind of peeping out behind the pedestrian bulb out, but it will slow right down because this is now a walkable street. It's a street that is designed to safely accommodate people as well as cars, and then drivers will behave very differently, and then pedestrians will come out, and this will be an activity-friendly street. And then here's another example, and as I convert it to the activity-friendly version, again, you can see now that cars are going to be slower and that this is this kind of place that pedestrians will want to come. And as I mentioned earlier, support local businesses. One more example, which I was personally involved with. This is Batesville, Arkansas, a small town of about 10,000 people down there in Arkansas. And I was part of a group that came and did a walk audit here, created an action plan to improve this street for pedestrians. And the ideas that the local community members came up with led to this particular creation of a vision. And the community has pretty well built this vision. It looks a lot like this. And I just want to go back and forth a couple of times here so you can see that car with the headlights there right in the middle of the picture. It's still there, but now we're down to this was always a one-way street. We're down to one lane. We have parking, we have textured pavement, we have landscaping, and we have people, and everybody's going to go slower. So how do we do that? How do we get the car-oriented street to become an activity-friendly route? And I'm going to kind of work backwards. So what we want is an activity-friendly route. Well, clearly, to get there, we're going to need to have some road redesign engineering projects to build pedestrian bump outs, to build pedestrian medians, to reconfigure lanes so that they're narrower, to plant trees and put in other landscaping elements. All of that is part of a redesign project. And how do we get a local government to decide to do a redesign project? Well, we need to get the right policies and plans passed. So I think some of your communities already have complete streets policies, which say that all streets should be designed in such a way that all users can safely and enjoyably travel on those streets, whether they're walking, biking, driving a car, using public transit, using a mobility device or a wheelchair. And active transportation plans put more detail onto those policies for specific improvements that will be made. But how do we get a local elected body such as a county commission or a town council to adopt those policies and plans? Well, we need community advocacy and education to convince those decision makers that this is what the people want. And people really do want this. Having worked in this field for over 20 years, I know that when people are given a choice of the kind of community they want to live in, they want to live in a walkable community. They want to live somewhere where their children can walk to school, where they can walk to meaningful destinations, where there's not high-speed traffic destroying the enjoyment of their neighborhood. So the first step, in my view, in doing community advocacy and education is to organize a walkability audit. So that's where I am going next in this presentation, talk a little bit about a walk audit. And I'm going to now test my own tech skills again by stopping this screen share, going to this one, sharing the screen again, and oops, not that one. There we go. And playing you a little video about walk audits.
Walkable communities have many proven benefits for health, the environment, and the economy. A great way to ensure your community is reaping those benefits is with a walk audit. A walk audit is an assessment of the pedestrian safety, accessibility, and comfort of a particular area. They can be used to determine how walkable a route is, to bring the community together to discuss areas of concern and share ideas for improvements or enhancements. Because they include detailed note-taking, they're a fantastic tool for documenting specific issues and engaging the community in advocating for improvements. Inviting public officials along so they can experience conditions directly make them even more effective. Conducting a formal audit with a group requires some preparation. Luckily, there are some great tools that can help, like the free Walk Audit Toolkit, which you can download from AARP. It includes ready-made forms for reporting the conditions of sidewalks, crosswalks, intersections, driver behavior, safety, and comfort, and information about the preparations you need to make. You'll also want to make it easy for volunteers by supplying everything they need: clipboards, pens, and the audit guide, for example. It's a good idea to send the guide ahead of time so everyone knows what to expect. Also, think about how you record information. You don't have to jot everything down on your clipboard. You could do a photo diary of your walk and have people take pictures of everything that's interesting, distressing, beautiful, ugly, and compile a photo library to refer to after the audit. Or you can even take video. Point is, a walk audit can take many different forms. Here are the top 10 tips for planning and leading a successful one. Decide what you want to accomplish. Choose the route carefully, scout it ahead of time, and make sure everyone will be safe. Don't make it too long. A 1-mile walk audit can easily last an hour with stops for discussion.
Ian, your screen seems to have frozen.
Friends from the neighborhood and others whom you want.
Okay, I'm sorry about that. How long ago did that happen? Can you hear me?
Yes, I
Yeah.
believe about 30 seconds ago. Melinda,
Okay.
correct me if I'm wrong,
Let me. I guess
from the
I'll-
beginning.
We could still hear the audio very well, though.
But the video wasn't playing?
Correct.
Oh, well, I apologize. I will send the link. We'll just let the audio continue. But I assume it must be a bandwidth issue. And I'll send the link so that everybody can watch it. It's on America Walks website. Apologies for that, but unless anybody has any ideas as to how to get the video to run. Not hearing anything, so I'll just carry on.
Participants from the neighborhood and others whom you want to recruit as advocates to join you. Invite 1 or 2 public officials, such as planners, engineers, or city council members. Choose a guide, such as the AARP Walk Audit Toolkit, and send it to participants in advance. Bring along clipboards, printed guides, and pens, as well as a tape measure and camera. Before starting, remind everyone to prioritize safety. Consider what small children, older adults, or people with disabilities might experience. A stroller is a great tool to identify barriers or challenges. Stop every few blocks to analyze conditions, make notes, and take photos. And at the end, ask everyone to share their takeaways. Finally, take everything you've learned and build a compelling presentation to share with stakeholders and changemakers in your community.
All right, well, apologies for the technology.
We have the lowest tuition in the
Oops.
state. Explore over 4,000 programs at minnstate.edu/program.
Okay. Right, I will now attempt to get back to my slideshow. Actually, while I'm doing that, Erin, could you share the third and final poll question about walk audits with people? And I'm gonna see if I can share my screen again. There we go. All right, is that whole question up there, Erin?
Yes.
Yeah.
Okay. Awesome. I'm not seeing it, but that's okay. So I'd just be interested in your responses to that, but I'll go on a few slides and then ask for those results. So in that video, which unfortunately you weren't able to see, the AARP Walk Audit Toolkit was mentioned. This is the go-to tool for doing walk audits. It's free of charge. Just go to aarp.org/walk audit. You can either download a PDF and print off your own copies, or you can fill in your name and address, and AARP will mail you hard copies to use. It's in both English and Spanish, and it provides a lot of great information and education about doing a walk audit, as well as all of the worksheets that you take out with you on the walk, and you can hand them out to everybody who's participating so they can fill in what they're observing and create that documentary record of the walkability of your community. So before I go on to the next section, maybe Erin, you could share the results of the last poll. So a few people, just one or two, have led a walk audit. A few more have participated in one, but more than 50% have not led or participated in one. So just like the walk to school day, this is a really key action that you can get involved with in your community. And the place to start would be to go to that aarp.org/walk audit webpage. Download that toolkit, read through it, and it'll give, really detailed kind of step-by-step process for organizing your own walk audit in your own community, whom to invite, how long it should be, how to choose the route, and all that kind of thing, and then what to do with what you find out at the end of the walk audit. So what you want to do at the end of the walk audit is advocate effectively for change, and use the walk audit as evidence of the need for change, because the goal is to convince public officials to make new plans, new policies, and ultimately change the built environment to be a healthier one, more activity-friendly routes. And I mentioned the Walking College earlier. I want to get into a little more detail here. This is a great opportunity to become a very effective walkable community advocate. As I mentioned, this is about a 6-month training. We expect between 5 and 10 hours per week of engagement from the fellows. It's a competitive application process, which is actually open right now. Every year for the month of February, we open up our application process for the Walking College, and we only have about 25 fellowships, 25 to 30 to award each year. This program's funded through the U.S. Centers for Disease Control and Prevention. We look for, it's not like some people are better at walkability or not so good at walkability. We look for people who definitely have the passion to change their community and are already doing something, but maybe just don't know what that next step is. And from the resources in the Walking College, we can tell that they will, become more effective and be able to make change. Also, of course, the networking benefit of getting to know the other fellows, getting to know the experienced mentors who are part of the program. The curriculum starts by looking at how we got here. What happened in the mid to late 20th century in American planning and transportation engineering that created these horrendous places that are so unsafe to get around, in particular for poor Black and brown people living in American neighborhoods. The conditions are much worse, kind of illustrating the sort of systemic injustice that was part of that process, and we train the fellows in that background. We move into modules 2 and 3. Each of these modules is scheduled for a 3-week period, and there are various readings and activities. Developing leadership and building a local movement, focus on those human skills around communications and cultural competency, coalition building, evaluating your community, setting the groundwork for a campaign for real change. We usually take a 1-week break after module 3, and then modules 4 and 5 are focused on those more technical elements. What kind of community design is good for walking and what kind is bad? And how can you change a car-oriented road into a pedestrian-oriented road physically by redesigning it? But then how can you change it from a public policy perspective? Because you need that complete streets policy, Vision Zero policy, active transportation plans, trail and pedestrian plans, on the books in the local government, so that over time these changes will happen. And the final module is focused on strategic planning. And during that module, the fellows will develop their own strategic plan. We call it a walking action plan, to do the work in their own community over the next 2, 3, 5 years. We recognize that any plan is just a plan. Nobody's going to implement the plan they write exactly. Things are going to change. Things they hadn't thought of are going to become issues. Maybe new opportunities are going to open up. So the plan is a guide. And then as the plan is implemented as best the fellow can, changes may have to happen. But the plan means that the fellow is well positioned to be able to make those changes and still achieve success. So, as I mentioned, that program is accepting applications right now. Go to americawalks.org/walking college. It's a fairly simple application form, 12 or 15 questions. We want to know about you, about your community, about what you're already doing, about what your vision is for the future, about partners that you may already be working with. And by the end of, this is going to stay open at least till February 28th. We'll take the month of March to review the applications and award fellowships where we feel that the resource will be most useful, and the course then starts at the beginning of May and runs through into September with a graduation ceremony in October. So just a couple of slides left, you'll be glad to hear. Talking about funding, I always recommend people to do some groundwork before even applying for funding. Maybe you've already done this in your community, but have a campaign, a communications campaign, build some local support, and if possible, get a pedestrian safety plan or an active transportation plan written and adopted, because a community that already has a plan is much more likely to get funding, because they can demonstrate, well, we've done the community engagement. We know this is what most people in our community want. And funding sources, can see that that groundwork has been done. The Infrastructure Investment and Jobs Act of 2021 is one of the largest sources of funding for walking and biking infrastructure ever. And there are various specific programs within the IIJA, which are used in particular areas, but all geared towards the kind of changes in communities that we're talking about here. Reconnecting neighborhoods with pedestrian and bicycle connections, safe streets and roads for all, focusing on sustainability and equity in rebuilding the transportation infrastructure. So these are great opportunities, and I know Hillary is here from FHWA, will probably be able to provide a lot more detailed information about these funding programs. There are more examples of funding sources lower down on that slide. And the Inflation Reduction Act passed last year also has a number of programs which are relevant. And a lot of these programs will flow through the New York State Department of Transportation to your community. So I'm just going to finish off with a few resources, and I will send these links to you, Wanda, so that you can share them with everybody, as well as that walk audit video that didn't run properly for us. This is an annual report by Smart Growth America, which tracks the number of pedestrians killed and injured and the conditions that lead to that situation. The Urban Street Design Guide, produced by the National Association of City Transportation Officials, is a very progressive engineering design document that looks at the whole community and prioritizes safety and good street design for pedestrians, bicyclists, transit users, as well as drivers. Project for Public Spaces, a New York City organization, has produced a lot of literature about placemaking, how to redesign a community to make it attractive and safe for walking and walkability. And this is one of my favorite examples, and I would love it if New York could produce something similar. In about 2015, the Colorado Department of Transportation, Department of Public Health and the Environment, and Department of Local Economic Development came together because they were hearing from leaders in small communities all around the state of Colorado that they wanted to make improvements to their main street, but because it was a Colorado DOT state highway, they were being told they weren't allowed to, that they couldn't change, they couldn't narrow the street down, they couldn't put crosswalks, pedestrian bulb outs, or even landscaping in certain places because there were some very rigid design criteria that CDOT, Colorado DOT, was imposing. They got together, these three agencies at the state level, and realized that those design conditions were not necessary or even beneficial in the communities where the main street was a shopping street, a street for people. So they created this tool for communities planners and engineers that presented a much bigger range of options as to how those main streets and state highways could be redesigned, and expressly gave permission to the community leaders in those small towns to request these changes or request permission to make these changes. It's really transformed a lot of small Colorado towns already after just a few years. And I always encourage every state DOT and Department of Health and Department of Local Affairs to get together and see whether they would agree that there should be changes to the kind of highway design guides. Finally, here's the AARP Livable Communities Pop-Up Toolkit. And I didn't talk much about pop-ups, but these are temporary changes that you make in your streetscape to improve safety for pedestrians, slow vehicles down, maybe just put them in place for a month or so, do some evaluation and surveying, take them out, but then look at how people responded, and generally the response is very positive, and this can then lead to the decision to make permanent changes. So with that, I'm going to stop my screen share and hand back to Wanda.
Okay, I wanted to make sure I was unmuted. Can you hear me?
Yeah.
Perfect. Ian, first of all, I want to thank you for such a great presentation, but we also want to give everyone the opportunity for a Q&A. If anyone here would like to ask Ian any questions in regards to his presentation, or anything that you see that you might like to do in regards to what he just presented. So please take the opportunity to do so. This is the perfect time for it. Oh, and unmute yourself, please. Or you can put your questions, actually, you could put your questions in the chat.
I only had one question in the chat.
Okay.
From Colleen, do you see specific stakeholders stepping up to lead these efforts? Or is it generally a consortium of partners?
That's a great question. Public health is one of the strongest advocates for community redesign. The program that Wanda and you, Melinda, are funded through is creating healthy schools and communities. It comes ultimately from the New York State Department of Health and from the U.S. Centers for Centers for Disease Control and Prevention. The public health sector figured out 10 or 20 years ago that it's more effective to make the policy and community design changes that make communities walkable than to simply lecture people that they ought to walk more or get out and do exercise. That really doesn't work if the community is not welcoming to physical activity. So public health are the leaders in this field, I would say, along with community advocates like myself. But more and more, the planning profession and the transportation engineering profession are coming on board and seeing how these communities work better in a whole range of ways, safety being one of them. But other partners, you know, are important. I put that first question up and included, you know, education and research. The data can really show the need for certain changes. Social services, poor neighborhoods are more adversely affected by bad road design and lack of safety. And so social services will very often be a really helpful partner in connecting with people and building that advocacy. And local business as well, a variety of different types of businesses. So it is a range, but I would say public health is the lead partner in most communities.
Okay, we have a hand raised by Maureen and then
Thank you.
Karen.
Thank you so much. So we had the opportunity of being awarded a grant for a comprehensive plan. I have a number of questions within that. So in putting in the plan, it would be great to include a survey. I'd like to learn more about that. So this may not be the time to discuss an in-depth survey, but how do we approach that and who can I speak to after?
Yes, community engagement is absolutely central to a comprehensive planning process. And if your community has received funding to conduct a comprehensive planning process, which will come up with a big picture vision for what your community members want your community to look like in 20 years or something, that's a tremendous opportunity to put in place the wheels of government to make that actually happen. It's unfortunate that we can't transform a community in 1 year, but it's just a hard fact. But we really can transform a community in 20 years. And if you just look back 20 years at what your community looked like then, you can see that changes have happened. And by creating that comprehensive plan, and then just creating the plan isn't enough, because the plan in general is not a binding legislative document. The plan must be then used by the elected officials to pass ordinances that actually, you know, make the changes that implement the plan. But the plan is a great first step. And as you recognize, it's really important to have community input. So a survey is a great, you know, is an indispensable tool. The kind of questions you want to ask people are, you know, about their transportation modes at the moment, about, you know, their opinion of the walkability, the bikeability, the safety of the community, about what their desires are, what would they like to see changed. But surveys shouldn't be the only tool. Doing walk audits as part of the comprehensive planning process is a very good idea. Depending on how big your community is, you might hold a series of workshops in 4 or 5 different neighborhoods, advertise them in the neighborhood, comprehensive planning public workshop. Come and share your ideas for your community, and then build a walk audit in as part of that, where you'll take everybody out to observe for themselves using those AARP checklists. All of that input should then guide your consultant or your planning department in writing that comprehensive plan and faithfully putting to paper what the people of your community want. And I think you'll find it is not more, faster, wider roads and businesses set way back behind parking lots. It's a walkable neighborhood, walkable community.
Thank you. Part B of that question, we also will be submitting a grant for a playground in an existing park that has been a work in progress over many years. Do you recommend the same process?
I certainly recommend as much community engagement as possible, and using creative strategies. People are busy, people have their lives to live. So simply having, having a meeting at City Hall and saying, okay, we're going to make some changes to this park. Come and tell us what you want, is not effective. Much better is to hold the public engagement process at the park, especially if it's in a neighborhood, and go and leaflet the doors of the homes, door hangers. We're having a meeting in the park. Bring your children. We want to ask them what they want. Look at the facilities that are there right now and get a vision from the people living close as to what they'd like to see. And then, design the improvement to be responsive. Elected officials really love this because they can, lead these efforts. They can hear what their constituents want, and then they can make the votes and the decisions to actually implement the changes that people want.
Thank you.
You're welcome.
Question, Ian, thank you for the presentation. I was interested in your list of resources, especially the Colorado downtown. But
Yeah.
You probably know this, but your participants may not. I've been following for some years a concept for traffic calming, traffic regulating, telling people in small and medium neighborhoods that pedestrians have priority, vehicles can come in. And it's a Dutch concept called a Woonerf, WOONERF.
Yeah.
And it's big in Holland, and it has streets have bump outs and trees planted. And basically, if you drive in, you say, gee, I'm not sure I should be here, but oh, there's a car down there parked, so I guess it's okay to drive on it. But it tells you like this is for pedestrians. And it's caught on in Great Britain a lot. So I would just advise the group here, check out the term Woonerf. And you may have some material you can send. You probably have a lot more than I do, but I thought it's a European concept that has great applicability here, and it's easy to do, and it makes the street look a lot better too.
It really does. Yeah, it's a great concept. Encourage everybody to look that up, the Woonerf. And it seems counterintuitive that you would design neighborhood streets to be difficult to negotiate by car. You're not making it impossible, but you're just making it impossible to drive at unsafe speeds. And you want to discourage cars from cutting through neighborhoods, if they can stay on a main road. And what you really want to do is, if somebody has only a short distance, something like 30% of morning traffic between like 7 and 9 is parents driving children to school. And that creates its own safety issues. If we could get those kids walking to school, then there would be all the benefits for the kids and their learning and their health and so on, but there would also be fewer vehicles in these areas. So the Woonerf is a very good strategy for making it more convenient to walk to a destination that's not too far away than to drive, and I thoroughly support it.
Thank you.
Thank you, Karen. Ian, it looks like we have one more question by Burton Delander. I live in a New York State rural area, state and county 2-lane highways, not much commercial area on the 2-lane roads. Is this environment a good place to do a walkability audit?
Well, it's certainly very important to audit those 2-lane highways that create challenges for walking. I think the first question is is there already a reason for people to walk here? And if there is a school just outside the edge of town and this 2-lane highway, you know, could be a walking route, but maybe isn't because it's unsafe. The vehicles are going too fast. There's no sidewalk. It's not attractive. Then I think a walk audit could be a very useful tool. There's probably not a lot of point in doing a walk audit in a completely remote area where nobody's gonna want to walk anywhere. So you're looking for that sort of balance point. There's not, you know, there's also not a huge amount of point in doing a walk audit, or maybe there is in a really walkable area. That can be quite instructive because you can see, you can analyze what it is, what are the design parameters. Generally, it's narrower lanes, narrower streets, sharp corners so that vehicles have to slow right down in order to make a turn. But in that sweet spot in the middle where you know that people could be walking, but there's an issue, those are the places to pick to do the walk audits.
Thank you. Thank you again. I have one, I see your hand, Amanda. I have one from, it looks like Frank DeMeo, Liberty Town Supervisor.
Yes, thank you, Melinda. Appreciate it. Ian, thanks for your presentation. It's great. I have a question. And you seem to have some knowledge of this because you mentioned about how you wish the New York State DOT would come up with something like Colorado, because honestly, the DOT is a very rigid agency. And I was just curious, how did that come about in Colorado? Was it advocacy? Was it just some politicians finally decided to say, hey, we got to be a little creative with this?
Great question, because I think understanding that is so important. I think, like with many complicated things, there were a number of factors that came together at the right time. I think there was leadership in those 3 agencies that was open to this idea. There was also a program called the Walkability Action Institute, which at that time in the mid-2010s was an in-person, like 4-day-long training put on by the National Association of Chronic Disease Directors, notice the public health connection again, and a team from Colorado attended. It's a little bit like the Walking College, except it was teams, but they were specifically looking for a team involving an elected official, a public health professional, a planner, a transportation engineer, a member of a community advocacy organization, maybe one more, six-person teams who kind of were already working together, knew each other, to come and get 3 or 4 days of training in policy and design changes. And the architects of that document from those 3 agencies all were part of that 4-day training. And when they got back, they kind of came up, this was sort of their action plan coming out of the Institute. I was a member of the faculty kind of giving presentations and so on at that Institute. And this was their sort of final project coming out, was to put together this publication. They did it in pretty short order, in something like 6 months or so. It's available online, as I will follow up with the links so that Wanda can share them and you can all check it out. The preface, I think, talks a little bit about that history. I have presented this idea throughout New York State. I'm a consultant with this Creating Healthy Schools and Communities program, and that program, which is run by New York State DOH, could achieve so much success if New York State DOT could become a full partner, and we're making progress with that, I believe. But it could, take advocacy from the communities. If you know your regional engineer for NYS DOT, then please engage them. Share this document with anybody you know and say, why doesn't New York do this?
And I'd be happy to walk beside you in your efforts. So,
Thank you.
Much appreciated. Thank you, Ian. Thank you.
I think that's a wrap. I don't see any.
We
further
had
questions.
Amanda, actually.
Amanda said that she would address it later on. We talked about it on the side note. Thank you.
Okay.
Wanda.
Okay, so any other questions? Okay, so first of all, I want to thank you, Ian, for such a great job and answering everyone's questions. Thank you so much, for everyone attending. So it's a few minutes earlier. Actually, we're running 3 minutes ahead of time, but it's the great time for us to take a quick stretch and coffee break and restart promptly at 10:25. So we'll see you soon. Do what you need to do, and then we'll come right back. Remember, 10:25. Thank you.
Bye, everybody.
Thank you, Ian.
Wells, but thanks for the info anyway. I'm going to be brief. I think the response to Ian's presentation was really gratifying. The enthusiasm, the thoughts that some of what he presented is applicable here was great to hear. To be honest, I do believe that this kind of work in Sullivan County is a bit of a challenge. We have been pushing complete streets for years. The good news is that we did get from New York State Climate Smart Communities Program last December an award to create a bike ped plan for Sullivan County. And at the end of Ian's presentation, he noted that having a plan was really helpful in place for going after future funds. We're going to be embarking on that plan for Sullivan. We anticipate executing a contract with the state sometime next month, hopefully. Then we'll have to go out and find a consultant. So probably be kicking up this work at the beginning of the summer, right in season for walking, hopefully before it gets unbearably hot. Although, I'm always saying shade is an important part of walkability, so we can underscore that. A number of other points, building on what Ian said, and also just, I want to be very focused on what's going on here in Sullivan and the history of what we've been doing and where we're going. So just in terms of, walk audits and walkability, Sullivan Renaissance, which is on the Zoom represented here by Shannon Salento, did bring in national walking expert Dan Burden to do some walk audits a few years back. I think they did Monticello, and they also did Kanianga Lake, if Maureen is still here, although I'm not sure I see her. We have those walk audits in the vault and can bring them out. We've also done a specific complete streets plan for the hamlet of Kanianga Lake, and that is also sitting and ready to be pulled out of the drawer, when we can generate interest. To be honest, again, things are a challenge here. One of the resources for these projects mentioned by Ian is the TAP, which provides 80% of project costs, which is really substantial. But if you're talking about a multi-million-dollar project, communities of our size may still find themselves challenged by that 20%. And it's my understanding that's why the Kanianga plan hasn't moved, because of the hurdle of that. There has been some publicity on the fact that we did get the grant to do a bike ped plan, and that's been, well reported, which is gratifying to see, but also generated responses. I've received, emails and calls of people really interested in the project. But one of those emails really, struck me out as being, somewhat emblematic, in that this person wanted to bring participation to their town hall and, really advocate for this. And she was concerned that she would get, a lot of pushback, be laughed out of the room, whatever, mainly on the cost issue, that, the idea of providing walkable amenities, whether it be a sidewalk or, a road shoulder or whatever, that the cost of doing those things was going to be too prohibitive for our county. That said, I think one of the reasons we're here today is to bolster the rationale and resources for why it can and should happen here. And the public health argument is really, really strong. I thought it was interesting to hear Ian say that public health is one of the key partners or advocates for doing this kind of work. And, Amanda will talk next about that. But I just thought I would share a few statistics that we've been using in our grant work, which people may or may not be aware of. The obvious thing is that, walkable and bikeable communities encourage healthy forms of mobility, active transportation. And there's lots and lots of documentation that they lower, yes, I am screen sharing, lower rates of chronic disease correlated with inactivities such as, diabetes and obesity, both of which contribute to Sullivan's abysmal health statistic. But something, I actually never think of in terms of health, because it's the ultimate bad health, is that motor vehicle traffic injuries are the fourth leading cause of injury-related deaths in Sullivan County. So
I'm sorry, Freda, can you
What?
open up your screen a little bit more, because we can see all your slides on the side.
Oh, okay. Yes, thank you. I did not start the show. It's still in edit mode. So hang on a second.
Thank you.
Slideshow from the beginning. Okay, how's that? All right. So every month, someone dies in a motor vehicle related accident in Sullivan County. 2 or 3 hospitalizations and some 50 ER visits. We're a county of 75,000 people. So, one doesn't sound like a lot, but in the context of our population, it's significant. One of the funding sources that Ian mentioned was this federal program called RAISE, and we have applied to the RAISE program once before to try and get money for our bikeway project, the Sullivan ONW Rail Trail, which you're probably all familiar with. And we didn't get it first time around. We didn't expect to, because these things take probably a few tries before you're successful. But we did it so that we would have the opportunity to get feedback from the funding agency. And one of the things that really struck me from that debriefing was the reviewer didn't trust the statistics that we reported, which we get from New York State Department of Health. So, it's as good as the state health statistics, but they were just so staggering to him from a national level. He found them incredible. So I just want to convey that out there, because for us, focusing on safety is even more important than just, everybody needs to focus on safety, but we really need to focus on safety. Some of the data available from the state is a little on the old side. So, I think they're still showing 2014 data on their website. In addition to the human toll, it's also a big economic toll. 6.9 million in hospital and ER charges. And then to put our statistics in the context of the state, I don't have nationwide figures, but our vehicle-related mortality in Sullivan is 14.3 per 100,000 population. But the statewide figure is only 5.1. So our county rate is 2.5 times the New York State average for motor vehicle related deaths. And, we're a county where our population is low. So you would think our vehicles are low. And I guess that correlates to the point again that Ian made about less traffic, more accidents, more death. People drive fast around here. Another really staggering statistic that I think people should be aware of is that when you break out these statistics by demographic group, the vehicle-related mortality in Sullivan for Hispanic people is 23.8 per 100,000. That is nearly twice the rates for whites. And while our statistic here for Sullivan Hispanics is twice what whites are, statewide, the Hispanic trend is even lower, fewer deaths for that population. So this disparity is really, really strong. And it may be, we don't have, a statistic is a statistic. There's no reason for it. There hasn't been any study done on actual correlations, but I would suspect that it might be related to the fact that our Hispanic population tends to be more economically distressed, and they do tend to be without vehicles and walking more on the road. Which brings me to the economic case. Lack of affordable and frequent public transportation. It is fabulous that after many, many years, we now have a public bus system, which I shouldn't say affordable because the bus system is now free. It's probably an old bullet point. But it's not, it's not the subway. So it's still an acute challenge for lower income residents who lack their own vehicles. And that brings me to the vehicle statistics, again, which makes Sullivan such an anomaly within New York and also within rural populations in general. When I lived in the city, when I moved back to New York City after living in rural Massachusetts, the first thing we did was get rid of our car because it's easy not to have a car there. But up here, it is essential. And in rural communities across the country, car ownership tends to be high. Here, in our most populated towns and villages, the rate of households without a car is 2 to 5 times the national rate. So, you would think we're a rural county, everybody, has a car to get around, but it's just not true. Village centers and some hamlet centers have sidewalks, but our village and hamlet centers are really small. They're basically a couple of blocks. A quarter, it's kind of a standard in the planning world that the distance for walkability for someone to walk instead of getting in their car is a quarter mile. But our hamlets are less than a quarter mile. It's really hard to find, unless you're going to go for a hike in the Catskill Mountains, or now we have great hiking trails in Lake Superior. Unless you're going to go for a hike, it's really hard to find a place to walk where you can walk more than a quarter of a mile or half a mile. And even though we have these dense village and hamlet centers that we perceive as walkable, there's something called a walk score, which crunches a number of factors and figures, kind of like our health ranking. Somebody's doing those calculations, and out of 100, they get 56 and 63. So what we think of as walkable, not really that walkable. And then when we go farther out of field into our other hamlet centers, those are definitely car dependent, scoring as low as 22. So we have a lot of challenges. We are going to take the first steps to meet them with this Bike Ped plan. And also every year we bring the Department of State division of, gosh, I forget what division it is. It's the Department of State division that has the planners in it, and they come out and they do annual training for our planning and zoning board members. And this year we are having presentations on the comprehensive plan, which should help Maureen and hopefully our other communities that need updating. But also we're kicking it off with a workshop or presentation on bicycle and pedestrian friendliness. So how planning and zoning board members and local regulations can use that development review process to promote development that is more walkable and more bicycle friendly. Not all projects have to be these huge capital projects from state or local governments. You can increase your walkability incrementally by just making sure that your new projects, take that in mind. And this is actually a subject really near and dear to my heart because in one of the first jobs I had, out of graduate school. Not only did I, work on a rail trail project, which, brings me back to the ONW, but we produced a guidebook for Massachusetts communities on bicycle and pedestrian friendly zoning regulations. These concepts have been around for a really long time. It is difficult to get traction, frankly, but that doesn't mean we should stop trying. And hopefully, I think there is a coalition and a greater interest and a growing interest in seeing these things happen. Erin talked about the VU nurse. I remember learning about VU nurse in graduate school and being really excited about it. That was a long time ago, not common yet, but we live in hope. And that is it for me.
So thank you, Freda. We were hoping to do a Q&A at this moment, but we're running a little bit behind. So I really want to thank you for your presentation. Our next speakers are Amanda Langseeder, Manager Director, and Shannon Salento from Community Development Program Manager for Sullivan 180. Amanda and Shannon were collaborative with the Sullivan 180 Board of Directors, staff, volunteers, and diverse community partners to grow the organization and to deliver on its long-term vision to improve health outcomes in Sullivan County through programs, strategic planning, and community outreach. Thank you, Amanda and Shannon.
And thank you, Wanda. Thank you, Cornell Cooperative Extension, Colleen, Melinda, Erin, everybody who's done so much together today. Really appreciate that. And being here with all of you. I will go through some of my slides relatively quickly because I love the fact that Freda, our county planner, is so connected with some of the health data that collides with this issue. So just as a little background, Sullivan 180 is a not-for-profit organization dedicated to building a healthy community through people, places, and policy with a very intentional focus on prevention and empowering a healthier generation.
Amanda, I'm sorry to cut you off real quick, but we still have Freda's slides.
Oh, I will stop screen sharing.
Okay.
And I apologize for going over, and I apologize for keeping my slides up.
Okay,
Oh,
thank you.
All good. All right. So
And for stealing a little bit of your thunder, Amanda.
I can totally handle it.
Together.
I can absolutely handle it, but somebody, oh, now I can't see you all. Hold on. Can you see the slides now?
No.
Oh boy. We even did this before and everything. 1 second here. How about now?
Almost.
There we go.
Almost? Okay.
We can also see the slides on the side.
Okay. All right. I think we should be good to go now. Yes?
Yes, we're
Okay.
perfect. Thank you.
No worries. So it's probably no surprise to many of you that Sullivan 180 was joined most recently by our sister organization, Sullivan Renaissance. All of us on the team are very excited about this. Sullivan Renaissance, of course, had 20+ years of experience doing community beautification, grants, community development, beautiful, just all the incredible things that you saw really impact the look of our community. And the fact that we can now come together and do this work as one organization is just a really exciting opportunity. We are all together committed to change by degrees. That's the reference to 180, of course, doing a 180 on our health outcomes. We are working with partners, schools, and communities through a very grassroots and inclusive approach where absolutely everyone can participate in turning around the health of Sullivan County in some way. Sullivan 180 offers grants. You'll hear more about those later from Shannon, technical assistance, and a variety of programs And through our initiatives and in collaboration with all of those community partners and volunteers, we are committed to making Sullivan a healthier place for a significant reason. It is the number that keeps me up at night and may really haunt all of us, and it's being number 61 out of 62 in the Robert Wood Johnson County Health Rankings. So again, we're really together today and look at this and look at slides. We'll move forward. So that next slide there really is just that reminder of some things that Fred had talked about before, which is the social determinants of health. Across the nation and our region, and definitely Sullivan County, there are meaningful differences in social and economic opportunities for residents in communities that have either been cut off from investment, have experienced discrimination, and these gaps definitely disproportionately affect people of color, especially children and youth. They are often referred to as health disparities or issues of health equity. And I will really quickly just give you a very real life personal example. Prior to coming to Sullivan 180, I worked for the hospital system and was on the ICU at the height of COVID. And I was doing Zoom calls with many COVID patients and many COVID patients that were passing and their families who were saying goodbye over Zoom. And as I moved about the rooms on the multiple ICU beds, I started seeing a whole lot of Jose's and Juanitas and clearly folks, who were Hispanic all over throughout the ICU. And it really started to get to me. I remember calling Melinda, who's on this call today, and saying, what is going on? And I grabbed a nurse and said, what is happening on this ICU? And she said, Amanda, these are individuals who perhaps didn't have COVID information in their language. And are living in environments where they are close to a lot of family members living in close quarters in general. So the virus is spreading very quickly. And I only share that story because it's just a great example of how your environment affects your health. And certainly in COVID, we know that was occurring. There were Hispanics lacking educational resources and again, living in close quarters. The physical environment where an individual lives, learns, works, and plays, where they breathe the air, where they, the water they drink, the parks they play and move in, and the transportation that they access to travel to work and school after health out. No shadow of a doubt about that. And so really here locally, we use data to inform our action whenever possible. Sullivan 180 and many partners, including Public Health, Garnet Health, Cornell Cooperative Extension, and others align our work with the priorities and strategies that were identified in the Community Health Improvement Plan. That's called the CHIP, and it is based on our Community Health Needs Assessment, which we call the CHA, the CHIP and the CHA. The Mid-Hudson Region Community Health Assessment is performed every 3 years. It is led by epidemiologists, university research experts, and has the support of the region's hospitals, health departments. You can easily access this data at any time on the county's website, the public health website, on our website, and the hospital system's website. So it is data that we share and want to share throughout the community. And in regards to Sullivan County, there's some important data here that we need to look at when we're talking about trails and parks and safe routes. We are on the decline as a county for the amount of adults participating in leisure time physical activity in the past 30 days. And what you aren't seeing is the other inverse chart, which is obesity. Our adult obesity rates in Sullivan County are absolutely skyrocketing. 2013, we had a obesity and overweight rate for adults in this county of 63%. We are now almost at 70%, and that's 2018 data. So that's data before the pandemic. And we know that the pandemic had certainly a significant impact on people's ability to get out and be active without a shadow of a doubt. So that's part of the data right there. And then of course ties into our highest rates of cardiovascular disease, heart disease. We are getting ready for the Heart-a-thon this Friday. So I encourage all of you to make sure that you get out. If for no other reason, then here we are in Sullivan County with the highest rate of cardiovascular disease amongst the Hudson Valley. And certainly again, a tie to that increasing rate of overweight and obesity. And then the last data slide that I have is this motor vehicle mortality rate. Oh, did I skip one? Sorry. I'm sorry, I did go back. I just wanted to mention the Monticello FitPad project. For those of you that have been involved in making that project happen or about to happen, the FitPad, the folks from the National Fitness Council very specifically asked, is this FitPad going in a location that is walkable to underserved communities, communities of color, people that can take advantage of this FitPad and physical activity that wouldn't normally have access? So just a great correlation of where planning, again, is looking at health outcomes and looking at the places where we can put resources to help here. But I think this slide or this data point probably tells it all. It certainly supports what Freda was sharing before. We need more conversations around safe roads. When you take just one glance at this and where we're at with motor vehicle crashes, we have to continue these conversations. This has Freda mentioned again, it's a public safety issue. About a year ago, just a personal story again, I moved to Coshocton and I'm just about a half mile off of Route 17B. I believe it's been labeled one of the most dangerous roads in America. Don't quote me on that. But I literally get on and off of this highway every day. Every day I watch my children get on and off buses right on 17B. And I have stopped walking. I was a person, an avid walker, and walking on 17B terrifies me. I saw it coming into work this morning, a runner right on the side across from the White Lake Firehouse that almost got hit by a passing car. It was very, very close. So clearly we have data that backs up the need to make change in this space. So hopefully I've given you the why, and then I'm going to go back to our slides really quick and hopefully inspire you with a little bit more of the how. Shannon, can you just give me a nod that you're seeing the slides again? Great. So just a little bit about the what's happening in our community to make change. I'm tremendously proud to have been working on the 4th E in John Little's 4 E's. If you're familiar with our Commissioner of Human Services, he developed a 4E pathway, a roadmap to better health. Those 4 E's included easing access to care, ending the opioid crisis, enhancing communities, and encouraging healthy behaviors. And we asked our community partners to help us with that last E, encouraging healthy behaviors. And 13 county organizations, including nonprofits and the government sector, made changes or implemented programs and strategies known to reduce smoking, reduce obesity, and increase physical activity. And as it pertains to today, I just wanted to share that several organizations and businesses really focused on getting employees out on their local trails. They took employees out for group hikes. They shared the ONW rail trail map. They got groups out to the ONW events that are occurring. And so again, just a great connection of how we can utilize the incredible resources that we have here to change our county health outcomes. I'm going to stop talking now and I'm going to hand this over to my colleague Shannon to talk about the most important thing you're probably all wondering about, which is usually money and the grant programs from Sullivan 180 that support the critical work that you are doing to enhance your communities. And we thank you for that work.
Thanks, Amanda. And you can just put it on the next slide. I don't need to have control of the PowerPoint. We'll leave it here. Thank you so much. Good morning, everyone. And thank you, Amanda, again, for that overview. It's always a good reminder for me to, when we're awarding funding, to keep all of these things in mind. How are you as an applicant, helping us achieve our goals for community health? So it's a really great overview, and I'm glad to be part of this program today. So thank you, Wanda, for the work you've done on this as well. I am now going to dive into the funding we offer, which can help you achieve goals related to, but not limited to, but complete streets, safe routes to schools and parks, and more that we've been talking about today. So the Sullivan 180 Community Development Program has 4 grants, which I'll go over, as well as additional ways that we can support your efforts. So as far as grants, traditional grants and funding go, I'll start with the biggest, which is our community impact grants. These were part of Sullivan Renaissance, and you might remember them as the Golden and Silver Feathers. So those awards are $350,000 and $100,000 respectively. Those are made possible with support from Assemblywoman Aileen Gunther's office. So these are for big community projects. So entire park redesigns, rehabilitations, construction of a youth center, trail improvements, all sorts of things that are really transformative to a community. And then these grants are going to be released mid-March with a May 1st deadline this year. So we have not released the application yet for this year, as our municipal partnership grants are due first, and we don't want to have everybody applying for everything all at once. We'll stagger it a little bit. But again, those are going to have a May 1st deadline, and they have a 2-year lifespan. So you have 2 years from award to complete that. Because again, they're much larger projects. They're not season-long projects. They require a lot of permitting and work with the state, of course. Our municipal partnership grants are up to $20,000 for our municipalities here in Sullivan County. The project categories include care of public spaces, youth initiatives, building healthy communities, environmental stewardship, historic preservation, but all this year, all must include youth engagement or youth involvement. So again, those can be for park projects, trail projects, complete streets, walkability improvements. And that application is live now. If you have not yet received it, if you're a municipal leader here, you should have received it from me a couple weeks ago. If you haven't, please let me know. Those are due March 15th, so they have a quick turnaround. And those projects must be completed by October 1st. Neighborhood revitalization grants, these we have project-based and program-based. So for programs, those are going to be those community festivals, cultural festivals, neighborhood events, things that really bring the community together. And then we can do public art installations, placemaking activities, all sorts of things fall into that category. And we can also help with project design. So if you maybe have an idea, you don't know where to start, just let us know and we can lead a vision session. We can work with your community to figure out what is the best direction for your project. And those are accepted on a rolling deadline as funds are available. So those are available now. And all projects must be completed by October 1st this year, so over the spring, summer. And our final one are technical assistance grants. These are really great because they're kind of that first step for any large planning project. So in order to apply for larger state grants, federal grants, you need plans, you need professional consultants, architects, planners to help you, engineers to help you apply for these grants. So this is kind of that gap funding to help you get the plans ready, figure out what the next steps are in the process. So these are $5,000 for professional planning, design assistants, engineers, architects that you're working with. And those require a dollar for dollar match. And rolling deadline, those are rolling deadline as funds are available. Again, all projects must be completed by October 1st. As far as in addition to the grants, we've also done some site-specific events where we work with communities to address a specific issue. For example, in 2021, we worked with the Sleepy Hollow community in Monticello to create a formal, safe walking path from their development to the high school and middle school, elementary school complex. So we had a great day. We provided manpower, volunteers, planning, supplies, and we worked with the community to create that walking connection between a large housing community and the school district here. So
Yep. I'm sorry for cutting you off, but we're over 4 minutes. So if you can close it so that we can start with David.
Yep, this is my last sentence. So
Thank you. And I'm sorry, I apologize.
Yep, that's okay. So I just wanted to finish with that. We love these kind of grassroots projects where we can accomplish a vision in a short amount of time, given the right resources and participation from the community. So I just threw a lot of information at you. If anything interests you at all, please reach out to me. My email is shannon@sullivan180.org. And we're happy to help and enjoy the rest of the program.
Thank you so much. Again, thank you, Amanda and Shannon, for the great presentation. And finally, our closing speakers will be Dr. David P. Orr, Director of Cornell University Local Roads Program. And we have also, Dr. Hillary Eisbrands. She's PE team leader and senior road safety engineer with the Federal Highway Administration Resource Center Safety and Design Team. With more than 50 years combined experience, Hillary and David bring expertise in roads design, engineering, construction, safety, local and rural roads, complete streets, and more. These folks provide training and technical assistance across New York State and the country. Welcome, David and Hillary, and we'll start with David first.
Okay. So good morning. I had to jump away for an hour. I had another session on liability that I just finished up. There's actually quite a bit of overlap with some of these things. It's pretty cool. I apologize if I repeat something in the hour when was on before. I've got the first hour with the walking information, which is very useful and very interesting. And Hillary and I have known each other for a long time, and we're backwards from a lot of folks. We put the P first behind their name because we think being an engineer is more important than the degree we got because we were just stubborn. But hopefully you'll pick something up out of this. I want to take a little bit of a different tack than you might have. We're talking about funding, but I'm a big fan of talking about the road to safety in almost a different way than you might think. Once I find my mouse. So we're going to do a welcome. I'm going to use, to some extent, I'm going to try using a tool we have called Poll Everywhere. So if you'd like, you can open up Poll Everywhere. It's pollev.com, David Orr PE. You just search for that or go to the web and you can go to that. We'll use that. Or if you can't, that's okay. You can throw it in the chat pod and I'll look at your answers via the chat pod as well. I'm a firm believer in the KISS principle, so we'll keep it simple. But just want to do a few quick things as we go through to help get you thinking about ways to improve safety, okay? So we did a session on what is traffic safety. It was actually general traffic safety. And here's some of the answers that we got when we did this before. So chance of reducing crashes, protecting from hazards. And I see people already putting a few in. That's pretty cool. Injury-free, fewer accidents, though we used the term crash, which I'll talk about here in just a minute. Okay. But what does traffic safety mean to you? Okay. One of the challenges that we run into is, as our first speaker mentioned, we think, oh, that means less cars crashing. Well, that's not really what I'm talking about when it comes to traffic safety. I'm really saying traffic safety, less crashes, all crashes, less.
David, I'm sorry to interrupt you, but we can't see your slides.
You can't see my slides. I've
No.
shared it twice. Let me try again. It's okay. Is it sharing now?
Perfect.
Don't
Thank
ask
you.
me why I did that. It's Zoom and I were fighting each other this morning too. So I couldn't get some things to work and other things did, but that's the way it goes. So, but what does traffic safety mean to people is pretty important. Okay. So we may come back to this in a little bit. Once I find my mouse, there we go. Now, this is a video, just so you know, person involved was not seriously injured. Okay. By miracle, we don't know how, but it's a classic example of two wrongs not making a right. Bad intersection, we've got a lot of that. We heard earlier about why these kind of intersections can be risky. Person went through a red light. The pedestrian was walking against the signal. Nothing went right, but luckily one thing did go right. The person walked away with a broken arm and that was it. Okay. And the person in the vehicle was okay because they kept on their seatbelt. But the key is traffic safety includes more than what we think. Now, when Hillary and I were both in school, we learned the 4 E's: engineering, education, enforcement, and the fourth E became over time, most people would agree with this, and that's emergency response. It's especially important in a place like Sullivan County where response times, getting people to the hospital is very important because that golden hour really improves the chances that people are going to have good recovery. But we've learned that, there are things we need to think about a little bit more because we tended to silo these things. Oh, let's do engineering here, let's do enforcement here, we'll educate the public here, and we didn't really cross between these areas. And there's an old phrase that our old assistant director had on her door, and it said, if you always do what you've always done, you will always get what you've always gotten. What essentially it says is if we keep doing the same thing again and again and again, we're not going to see the change we want to see. Our first speaker, Ian, talked about pedestrians and safety. Well, we didn't get to the situation we have now in 2 months. It took decades. So I also am a fan of thinking about magic BBs. It's not going to disappear overnight. It's going to take some time. And so Federal Highway has come up with a new thing called the Safe Systems approach. I know Hillary's going to talk about that a lot more than I am, but I just want you to be thinking about the fact that we're incorporating more than just those 4 E's. We're looking at all the elements, the vehicles, the speeds, post-crash care, everything combined. We've still got those 4 E's, but we're looking at everything from a redundancy standpoint so that one mistake doesn't lead to a fatality. One mistake doesn't lead to someone being injured for life. So think about that from the standpoint of improving safety in your community. How can we make things safer for everybody and reduce the chances that people are going to have a bad day? Now, one of the big issues that we've got to deal with, and this is really important in a rural area like Sullivan County, all the upstate counties, and even within a bigger community like New York City, is a concept of systemic safety. I've got a picture. This is a Southern Tier fatal crashes from 2012 to 2014, so a 3-year period. And this is a map. I'll highlight the location of the fatal crashes that occurred. Okay, there they go. I'll take it down and back up a couple of times because it's easier to see it when it moves. Can you see any trends? Can you say, oh, we've got a problem here? Well, it looks at first like there might be a couple of clusters until you start thinking about scale and realize these crashes, these events occurred miles apart. The closest one on this entire map is over half a mile apart. What's happening is we've done actually a pretty good job, especially in rural areas, of taking care of the most critical places. But what's happening is crashes are occurring randomly. So places with sharp corners might occur in corner A this year. We fixed corner A, but now it occurs in B next year. So we really need to be systematic in our thinking, fixing places that have high risk. So we develop our transportation plans. As we think about how to fund those plans, we really need to be thinking about approaches that look at the whole, that look at everything. Now, there's a famous Venn diagram that talks about crash factors. I turned it into a big pie instead, just because I wanted to be different. And I think it actually shows it a little bit better because it's to scale then. If we look at crash factors, we have the vehicle that's involved about 13% of the time. We have highway issues, it's about 33%, and these are direct design issues. And then we have the human factors with 93%. It's a very famous Venn diagram. The problem is people see this and they go, well, there's nothing we can do, but 60% of the crashes because it's just the human who's drunk or driving too fast or texting on their phone. And nothing could be further from the truth. The highway design related things are defects in design that we are aware of, but we haven't done as good a job thinking about the human factors. And if we think about the human factors as part of the design, we can actually do quite a bit. But we also have to think beyond just highway design. We have to look at education. We have to look at the community. We have to look at multiple things to start attacking those human factors. There are definitely things we can do. Now, part of the reason human factors are such an issue is our expectations get broken. Our attention gets broken. And of course, you got to do with vision and other sight issues that we got to do with and other senses. Perception is reality, like it or not. If people believe something, it's probably real and there's probably a basis behind it. This is an actual sign from Belgium. Now, I don't know if it's aimed at the drivers to warn them people are on their phone, or whether it's aimed at the walkers to say, hey, be careful. You're walking near a roadway, but cartoon comes out, but reality also shows up as well. We can break expectation. Classic example, this is in Lake Placid. All these signs create just noise. It's really hard to know what the most important sign is. I can tell you right now, I know what the most important sign is. And when this particular picture was taken, every sign there was perfectly legal. And yet the reality is there's actually a sign which we shouldn't be doing there. Okay. It's that stop sign, or that hospital sign, excuse me. Come on, move forward. There you go. Hospital sign. So if you need the hospital, you want a sign that's blue and white. You've broken expectations. But when I took this picture, that would have been a legal sign. It wouldn't have been considered a highway defect. But it's a human factors problem. Don't break people's expectations. Think about their attention. Okay. You've probably all seen the famous awareness test. Yeah, you do.
Does the team in white? The answer is 13. But did you see the moonwalking bear?
Did you see the bear? Now I know it's jittery, but watch carefully. About halfway through, there's a guy moonwalking as a bear. There he goes. This is an ad campaign that was done in England dealing with bicyclists, because we know people driving think everybody else is in a car. So they don't see bicyclists, they don't see pedestrians, they don't see motorcyclists. And we know this is a problem. They completely miss and they crash into those people. And of course, they're very vulnerable because they're exposed. They're not inside that little metal cage. So think about that. What is the attention? What are people actually seeing? If you don't think about that, you can be problems. And of course, vision changes. We get older. It's hard to see things. We perceive things differently. This, by the way, is a still picture, and yet a lot of you probably think it's moving. So human factors is something we need to think about. And that really comes back to some of the things that I know were talked about before, and Hillary will mention later on. So when I've done this class before, I've gotten people answering, what can we do about human factors? Okay. And human factors is one of those classic examples. And I'm going to put in, while this is here, the address. It's in the chat, so you don't have to memorize that location. Okay. But let's see what you can do about human factors. People say very little, and I actually very much disagree with that. I think there's a lot of things we can do, but you've got to change perceptions. Some of the pictures that Ian showed where they changed the design, you change the perception, you change what people see, what they focus on. Because people will drive the way they focus. If they're on a bicycle or they're on an electric scooter or they're walking, what they're focused on is what they're going to be doing. So we need to be thinking about those kinds of things. There's actually quite a bit we can do about human factors, more than most people think. Now, in engineering, we love to deal with geometric standards. We have all kinds of them. There's something called the AASHTO Green Book. Again, we could do a whole class on that. There's New York State has its own version they call the design manual. They've got design standards for low volume roads, which most of Sullivan County would fall under. So there's standards out there, but I'm a fan of looking beyond just the geometrics, especially when it comes to improving safety. Think beyond what you've got. You could develop your own, by the way, but my advice is you still want to go back to national or state standards from a liability standpoint, but also consistency. Uniformity makes a huge difference. And one of the reasons that I'm a big fan of that is complete streets. Now, you've already heard that phrase. You may have heard the phrase traffic calming. I don't know if the speakers after I left talked about traffic calming too much. I actually like to combine the two. I don't think of them as separate things like a lot of folks do. I really think of complete streets and traffic calming as a single thing. There are some key differences between them, but really the more you think about it, really it comes down to how do we get everybody using a street? How do we get everybody calming down a little bit while driving at a speed that is reasonable? Because people drive based upon what they see, their perception. So I'm a big fan of this. If you haven't got that, great. But the problem with most complete streets, more importantly, most traffic calming, people fall in love with roundabouts and speed humps. And if that would be like going to a diner and saying the only thing on the menu is an egg sandwich and a tuna fish sandwich, they might be fine, but you want more choices than that. And there are tons of choices. There's vertical things, not just speed humps and speed tables, but whole kinds of things. There's lateral, there's restrictions, there's narrowings, there's entrance features into neighborhoods that you could do. There's streetscaping, as Ian showed. There's all kinds of fun things you can do, a lot more out there than you think. And you can even do some route modifications. So realize that traffic calming is not just one or two things. It's a big series of measures that have to be done as an area. You can't do spot improvements. It doesn't really do what you think. It just moves the problem from one point to another. I'm going to show you a picture of traffic calming or complete streets or whatever you'd like to call it. And most people are going to go, wait a second, that doesn't look like any kind of improvement. How is that complete streets? It's a rural area. It's very rural. This was in Yates County where I was before I was with the university, and must have some timer that's going to kick it forward. So I'm going to have to fight with it a little bit. I apologize for that. Here we had a situation where the old road, the one on the upper right, dipped a little bit and vehicles would disappear into the gap. And it was fairly narrow. You couldn't walk along the edge. We realigned it so that the shoulder was wide enough to walk on. And now the local community of Mennonites was able to put their school for their kids where they wanted to, where it was easier for them to walk, where it was safer for them to walk because they could be seen. That's actually a complete street. It's a complete street for that particular community. And that's the thing I would like you to think about when it comes to complete streets and traffic calming. Don't just assume everything is urban or everything looks like this. There's a huge variety out there, and there's a lot of things you can do, and look for some low-hanging fruit. Doesn't take much of a change to think about all the users. And there are a lot more out there than you might think that walk or bike in places you might not think about walking and biking. So lots of people have definitions for these two things. I have mine. This isn't federal highways. Hillary's going to probably disagree with some of what I'm going to say, but what the heck, here's my definition. I think techniques to allow all users to share the road as safely and efficiently as possible. That is traffic calming and complete streets, okay? Because really that's what we think about. So when somebody puts here in the chat, how can you accommodate walkability on county roads, particularly those where shoulder facilities are hampered by the existence of drainage ditches? Well, you're going to have to think about how do we meet the value of the ditch and the shoulder. And we, of course, have limited right-of-ways on county town systems in rural areas. You may have to fill the ditch in. You may have to make the shoulder wider so that it is safe to walk on. You may even have to think about, are there times when there's enough traffic to justify some kind of trail in the area, if it's even available? But you're going to have to think long-term. You're not going to fix the problem today. You're going to have to be looking longer term, developing a plan to improve things. Look at wider shoulders. Look at what is reasonable. We would go with a 4-foot shoulder when it's with the county, unless we knew there were a lot of the Mennonites or Amish who wanted to walk in the area. Then we would increase that with as much as we could do within the limitations of what we've got. Do what you can, where you can, with what you have. You got to identify the problem. And if I had to pick the one thing that I think is the most critical, and I'm really glad to see that you invited us, you got to have community involvement. It is the single most important element. Nothing else you do is going to work, but that means the entire community, even those who, well, you can see the guy on the left. He didn't think we were going to come up with a solution, but there actually are plenty of solutions out there, but you got to get everybody involved. Absolutely everybody involved. I'm a huge fan of road safety. Well, road safety audits are a more formal. Walking audits are bit more formal than I'd like to see. I'm a big fan of something we call road safety assessments. It's the same process as a road safety audit, but it's purposely non-formal to start. Start there. Start getting everybody, the same people together, get them in the room, walk the site for road safety or walkability or bicycling or whatever you want. Start informally, build that coalition. Then if you need to, you can go to the more formal documented process, but start with the simple stuff, the low-hanging fruit. You'd be amazed. You might get 90% of the way there by just walking the site and getting everybody to realize, wait a second, they really aren't speeding. The real issue is the people who live there. Oh, you know, if we just cut this corner slightly and then give people a place to stand or walk, everybody's safer. So look for the low-hanging fruit. And in terms of local road safety plans, I know Hillary's going to mention them. I'm a huge fan of them. But realize, like Eisenhower said, in preparing for battle, I've always found that plans are useless, but planning is indispensable. Plans will change. But if you have no plan, you have nowhere to go. Okay? Nowhere to go. So let me finish up a little bit and then pass it over to Hillary, who's got some really good information to talk a little bit about funding. Okay? Because once you have the plans, now you can think about how am I going to pay for those plans? Now, again, we'll see if people want to. Again, you can either throw it directly into the chat, or if you want to open up Poll EV, you can give me, what are your sources of funding? You've heard some this morning, but I bet you haven't thought about all the sources of funding, because there's really several major sources of funding we need to be thinking about. Let's see if anybody wants to put in an answer. Again, you can throw it in the chat. I don't have any problem where you put it. I just need to know that there's people are thinking. And it's on responses. Again, put it wherever you'd like. Nobody's putting it in. Oh, well. So what I want you to think about when it comes to funding, everybody likes to have these lists like SS4, safe, routes for everybody. We're going to have safe streets for all. Okay, that's federal dollars. And that's not a bad funding source. I have no problem with it. And Hillary's going to give you a lot more details about it. But think about the sources of funding you already have. Okay, what are those sources of funding? All local agencies in New York State get CHIPS funding. Okay, that state aid comes every single year. That's part of your system. Okay, that can be used for safety improvements. Nothing, in fact, it's really a good way to use your CHIPS money up. So you don't have to worry about the 10-year life rule that's in play. There's other state funding, as you already have just heard, through different organizations. Local dollars, there's Department of Health money, there's federal dollars, there's this new bill that's out there. There's actually quite a bit in terms of funding of sources. But all of these funding sources, every single one of them should really be looked at as, okay, I have a plan or I want to build a plan. How do I pay for it? We cannot grant our way out of all of these issues. This is not something that every municipality can get a grant and suddenly our problems are solved, because it's all our dollars. Because whether it's a federal dollar or a state dollar or a local dollar, it's all our tax money. We're just trying to use it in the most efficient way possible. And no matter what happens, 80 to 90% of your funding is still going to be local. So how do we use those local dollars to improve safety? Okay. And of course, Bill, bipartisan infrastructure law, or the Infrastructure Investment and Jobs Act, is just the latest funding source, and it's one of the largest ever. Okay, in terms of what we call it, you can call it whatever you want. I like Bill only because I got the logo for it, but the concept is, one of the things Bill has in it that sounds really cool is it has direct local aid provisions. Be careful about that, and I'll mention something at the end that might help you there. I like the idea, but there's some risk. But there's tons of sources out there. There's STIP, there's Tiger. We've heard a few others. There's Safe Systems for All. There's Bridge New York for bridges, which could include safety. You can improve safety when you put in a bridge. Make sure it's pedestrian friendly as opposed to barely wide enough to even get cars across it. Think about that. And by the way, if you do get federal aid, realize project timeline is longer than if you do it with local dollars. So just be aware of that. So again, this is again from another one we did, and I left it up here. I was right. I figured you might not reply, but what's eligible for federal aid and what can get federal aid do not always match up. First, it has to be eligible, but remember, you're competing with others. So if you've got a project, you may have a hard time competing if it's a small project. You may want to bundle those projects together or even look at your whole community, a series of projects to make it more cost effective, to make it big enough to get the federal aid or to get the state aid, to think about things like that. Okay. Again, I just wanted to mention the fact that if you are interested, we do have an online workshop on federal aid, the process involved. It's 4 hours. That's on March 2nd. And we actually have webinars on grant writing and revenue sources coming up the week after. And on our website, you can go look those up. You're welcome to show up and we'll talk more specifics about some of these things. And of course, we also, part of Cooperative Extension, we do workshops, mostly technical, but we do ones on budgeting and liability that you might find interesting as well. And with that, I'm going to just go on past so that Hillary can get going. But if you want to contact me, it's david.orr@cornell.edu. And Hillary, I'm going to let you take it from there. I'm going to somehow stop. There's my stop share. And it's all yours.
Thank you, David. And thank you, everyone, for all this insight that you have. It's amazing. And I am going to stay pretty high level today just because I'm going to be talking. One, we don't have a whole lot of time, but secondly, I just want you to know that I spend most of my days with folks just like you, trying to help local agencies and tribes improve safety on their roadways. And so although I come to you from the Federal Highway Administration, I've always lived in very rural areas. And it is the topic of rural safety is what I breathe every day. So I'm going to share my screen here. And if someone could give me a thumbs up once you see my screen, that would be great. All right.
Yep.
Is that in presentation mode?
It came up. Yep.
Okay, thank you so much. All right, excellent. And again, I thank Wanda for inviting us to be here today as well. This has been a lot of resources that I've learned. I always, every time I present, I'm always trying to take information away. And I've got about 5 sticky notes with information that I've already learned today. So thank you all for that. So I just want to, start off again, pretty high level with some federal funding opportunities, many that you might already be aware of. But I'm going to focus on the Safe Streets and Roads for All grant opportunity that a couple of you have referred to. It is new, and it is federal funding that can go direct to local agencies, which is not typical. Oftentimes in the safety area, the funding goes through the state DOT to the local agencies. So that's why this one is a little bit different. And it is a little bit different in terms of how it is broken down. So I'm going to cover that. I'm also going to talk to you about crash data. I am going to dive into New York State DOT's CLEAR database, which is our crash database. And you've heard this, I think, at least once. A lot of the funding opportunities do require some sort of a plan and some sort of data analysis or it being data driven. So we're going to try to cover some of those elements. And then I'm going to give you some overview and examples of local road safety plans and give you some definitions around that. This is a huge table. It's actually 2 pages, but this is a summary of all federal funds that go towards pedestrian and bicycle opportunities and improvements. Wanda has a whole list of attachments and handouts that she's going to be providing you after this. But this is a great summary of what the federal funding sources are. That's across the top. And then the activities and projects that it applies to. So again, oftentimes with a federal funding, there will be some sort of a match. Oftentimes there's collaboration with local agencies, with counties, with perhaps a region. And then ultimately it might be some assistance with the state DOT. And then of course, the LTAP that David represents. So I don't want to go into I'm not going to go into details, but this is an excellent table that helps you identify what am I trying to address and what funding opportunities might there be out there. I know someone mentioned the RAISE grants, and I'm going to talk a little bit more about the SS4A or Safe Streets and Roads for All grants that's also listed in this table. So this is a handout that you will see later. The other source of information when you talk specifically about rural opportunities, and this also goes beyond safety. This is our Roots initiative through the U.S. Department of Transportation, and it is looking for economic success. So I know we talked about that in a few of the conversations already. I did highlight on the right there is the RAISE grants. So that's a summary of the RAISE grants, and then also a direct link to how to get access to those grants. There's also something called Accelerated Innovation Deployment Grants. That also is something that we've seen great success with local and rural agencies taking advantage of that opportunity. So again, another direct link, and you will have a handout with this toolbox to help you get direct information about some of the rural grant opportunities that are out there that go beyond safety, but also include safety opportunities. So Safe Streets and Roads for All. This is actually how Wanda and I got connected, was through the question about safe streets and roads for all. It did come out of Bill BIL, which is our latest and greatest transportation bill that we have. And it does provide opportunities for local agencies to be direct recipients to federal funds. Now that's good, and that can also be a challenge in terms of the requirements that might come along with that. And I've clearly seen today the partnership that you all have. And that is really a critical element to not only applying for these grants, but also making these grants successful in terms of translating the funding and the collaboration into a working plan that can be implemented, and ultimately projects. So the key program is really looking towards zero deaths. We have a Vision Zero approach, both nationally. You can see that at the state level. You can see it at the city level, at the township level, at the county level. And it's really, this funding is really helping us hopefully get towards zero. It is $1 billion with a B annual funding right now for at least the next 5 years. The first round just completed, and I'll give you a little bit of summary of that. But know that this is an annual funding opportunity. So if you don't succeed, try again. I think we heard that with the RAISE grant. They're giving feedback for those that maybe haven't been successful, but please know that this is an opportunity that has not existed before. David said it most recently here in our conversation this morning. You don't need to put all of your eggs in one basket with federal funding, but it can supplement those other grants that were discussed earlier. It potentially could be an opportunity to have maybe a smaller grant that is not a federal grant that could be a match to the requirements that come out of this SS4A funding. So just to talk to you a little bit about why local agencies. So why is this funding going directly to local agencies? Well, it's because of the risk and the crash statistics that occur on the local road system. You can see there, looking at the fatalities by functional class, as well as the fatalities per 100 million vehicle miles traveled. I know Freda threw out some numbers that were specific to Sullivan County, but really this is a national look at what you were talking about locally, and that is opportunities in the local areas to improve safety. And how are we going to make a difference? How are we going to reduce fatal and injury crashes? So we have overrepresentation in many states in terms of the number of fatal and injury crashes that are occurring on the local road system. We also heard a little bit about our underserved communities, and you can also see here that nationally, this is an issue. And so this funding opportunity with Safe Streets and Roads for All, again, looks at partnership and looks at how we are addressing safety in some of our underserved communities. So there is definitely an element to funnel funding to agencies as well as areas within our communities that have been underserved in the past. So I'm going to note here, there's currently not a current notice of funding opportunity open for SS4A, but please follow the links for the SS4A funding, because again, this is an annual cycle and it will be posted again on grants.gov. So again, there's nothing open right now, but everything I'm sharing with you is an opportunity for you to potentially prepare to be an applicant for this funding. There are two really buckets of money, if you will, out of that $1 billion. And that is the action plan grants and the implementation grants. So about 40% of the funding will go towards action plan grants, and about 60% of the funding will go towards implementation plan grants each year. So which grant might be right for your community? Well, if you don't have a safety action plan, which can be a Vision Zero plan, a local road safety plan, tribal safety plan, or other similar safety plans, then you can go after the action plan grant funding. If you do, or when you do have a local road safety plan, then you are eligible, you become eligible to go after the implementation grant funding, which is exciting. So you can actually apply twice. You can get action plan funding grants, and then after your action plan is complete, you can actually go after the implementation grants, which then would ultimately be the planning, design, and the building of that infrastructure. So how do you apply? Again, you can apply as a local agency. You can apply as a consortium of local agencies. You can work with an MPO or an RPA, a regional planning organization. So you can completely go it alone, or you can, again, for the towns and the cities and the hamlets that are part of your county, you could collaborate and go after a grant together. And we have seen success at all different levels. It can be, like I said, multi-jurisdictional. Some of the things to think about is you can be, like I said, a joint applicant with another agency, another government agency. You can also have partners. So these partners might not be eligible to apply, but they can be partners in helping you create that action plan or help with the implementation. So grants.gov is where you can get additional information once the notice of funding opportunity is available. Meanwhile, there's great information on the USDOT website on Safe Streets for All. So you can see the resources, so you can help get yourself prepared now for when that funding opportunity comes forward here in 2023. If you have not been a direct recipient of federal funds before, there is some steps that you need to take in advance, and those can take 2 to 4 weeks. So if you are thinking you might go after this opportunity and you've not gone after it before, again, if you go on to grants.gov, it will give you information on how you basically need to have an application. You also have a process of getting a unique entity identifier. And those are all things that you can work on now prior to the notice of funding opportunity coming out. There is a series of templates, recorded webinars, resources for how to understand if you are eligible to apply, what do you do in your applications, and then ultimately the eligibility criteria that would need to be included in those applications. Please note that with the SS4A funding, there is a required local share of at least 20%. There's a FAQ on the website that talks about what is eligible for that local share. If there's a question later on that, I can throw that up on the screen and you guys can see about some of the opportunities there are to create that local share. We are trying to be as creative as possible for what it means to have that local share. And again, that 20% could not be federal funds. So you can't match federal funds with federal funds in this case. I want to share with you some successes out of New York from last round. So the 2022 SS4A grant recipients, you can see the map there. Those are the entities that were successful in both action grants and implementation grants in New York. So you might want to reach out to one of the agencies that was successful. So here you can see this is action plan grant recipients from New York. You can see there's a mix of rural and urban entities. This is all posted on the website. So even though I'm going to flash through it fairly quickly, this would be a great opportunity for you to reach out to other folks that have been successful with this grant opportunity. Again, these are the action plan grant recipients. And then secondly, there were 2 implementation plan grant recipients, that being New York City, as well as the St. Regis Mohawk tribe. And that's more in northern New York. So these are opportunities for you to reach out maybe and pick their brains in terms of their success in getting the grant, getting the grants for action plans and implementation plans. So I am going to keep going because we're going to do questions at the end, but I want to transition. Remember, I said that really to get access to the implementation grant funding, you have to have a local road safety plan. But I want to remind everyone, even if you're not going to go after that federal funding, it is good to have a plan in place. It is good to have a plan for how you are going to save lives in your community. And a local road safety plan is really how we can do that. It is a vehicle to funding opportunities, but it also is an opportunity to look within your agencies on how you are spending your funds, whether that's maintenance dollars related to replacing signs or adding signs on curves, or it is an opportunity to go after some of the grants that we've heard about today, or even working with New York State DOT on some of the grant opportunities that they might have available to you all. So ultimately, our goal with local road safety plans is to get everyone home safely. That is our goal, and it takes collaboration. It takes the use of data. It is honing in on the low-hanging fruit. I think David used that term, on proven solutions. What do we know that works to save lives? And doubling down on those strategies and solutions that help us save lives. And then clearly, we have to implement those solutions, and they can be low cost. Again, it can be signs. It could be high visibility crosswalk markings. It could be a roundabout. It could be adding rumble strips on a rural 2-lane highway where you've got run off the road crashes. There's a lot of opportunities for us to use our data, know what our risks are, double down on the solutions that work for those various risk types, and then ultimately implement those projects. So again, why local road safety plans? It's because in almost every state, there's a significant number of fatalities and serious injuries happening on the local road system. I have heard multiple times here today about the issues and the concerns and the risks that you all have in driving in Sullivan County. And that is where we want to make a difference. And again, there's opportunities through our local funding, maybe regional funding and grants, as well as state and federal funding. There have been successes with the deployment of local road safety plans in numerous states. 2 of those being, and are really our leaders, are the state of Minnesota and in the state of Washington. You can see there that they've seen significant reductions in fatalities and serious injuries on the local road system with the implementation of local road safety plans. So why should you create a plan? 1, it can enhance and develop lasting partnerships. We talked about the E's, but it's public health, it's advocates, it's really all of us rallying around the safety of our communities. It's advancing data-driven approaches, and it can allow for transparency in how you prioritize and fund your projects. Because we know we get pressure sometimes for the loudest voice might say, oh, well, it's unsafe in my neighborhood, or it's unsafe at that intersection. But by having a data-driven approach, you really can be transparent in how you prioritize your projects and your funding. It allows us to leverage funding opportunities as well. And then ultimately, our goal is to get people home safely, and that's reducing the fatal and severe crashes. I think it was Freda that said that someone dies once. There's 1 person that dies every month in the state in Sullivan County. That is a statistic we need to change. We can also look at our other vulnerable areas. We've talked a lot about heads in schools and crossings and walking along the road and crossing the road. What we want to do is we want to have goals of reducing those fatal and injury crashes. And we can look at pedestrians specifically. We could look at intersections specifically. We could look at roadway departure crashes specifically. Those are all opportunities for us to have goals related to reducing fatal and injury crashes. An effective plan is data-driven. It does focus on reducing severe crashes. It does include a mission and a vision and goals. We want you to have goals, specific goals related to reducing fatal and injury crashes by user type, by roadway type, and in terms of short-term and long-term goals. I'm going to share a little bit. Chemung County, who's north and west of you all, does have a local road safety plan that they worked in partnership with Federal Highway Administration in terms of developing that plan. And ultimately, a plan is only a plan unless we implement it. So how do you get started? It is identifying a champion or champions to develop that plan. And although someone mentioned that you can hire a consultant, we have successful local agencies that have done it themselves. They have developed the plan themselves using templates and ultimately been successful in getting grant funding and deploying proven safety countermeasures. It does depend on what your resources are within your county, within your local agency to do that. But again, there has been many success stories. Washington State, for one, many of the initial plans that were done by the local agency staff, planners, engineers, maintenance staff, coming together to develop that plan. We need to gather that data, and it might not just be safety data. It might be traffic violations. It might also be looking at our public health data. That is a very important piece. We also want to identify those proven safety countermeasures that solve our high-risk locations, that solve the problems that we are seeing on the roadway. And that a good way to do that is low-cost safety improvements and proven safety countermeasures. Again, more resources coming on that Wanda will send out to you. So there is a local road safety plan do-it-yourself website that was created, actually launched back in 2020. This is a result of a partnership that we had with the National Association of County Engineers, as well as the National Local Technical Assistance Program, and many pilot states, actually 10 pilot states from across the country, and over 100 local agencies that came together to pilot the development of local road safety plans. There's dozens of interviews of local agencies on why they invested in local road safety plan and why they are changing their vision and their practice in terms of addressing local road safety. I encourage you to jump on that website and check out a lot of the local agency insights that we have are videos of practitioners deploying safety countermeasures. There's also training and some other links, dozens of links on that website to example plans. So I mentioned that oftentimes data is required, and we should be using that data and information at the local level. So I want to share with you, I don't know how many of you are familiar with New York State DOT's, just checking the time there, the CLEAR database, which is fairly new, but it is a repository of the crash data that the state has. And it is a place for you to look and become familiar with. Now every agency might be able to dive in, but perhaps that is a request that you can work with the county to help you look at some of the data. So here is a snapshot of how to get access to CLEAR. You can request direct access to CLEAR. And then here's an example from Sullivan County of total crashes from 2017 to 2022. So this is all types of crashes, including fatal injury and property damage only crash. But wow, for such a small rural county, there's a lot of crashes. And we heard that earlier. And so I want to know more. When I see this, I want to know more. I want to know what types of crashes are occurring. I want to know if pedestrians are involved. I want to know if it's single vehicle. I want to know if it's teenagers. I want to know if it's older drivers. And this resource allows us to get more information and be curious, and then ultimately use this data to help us then look for those opportunities to make a difference. Here's an example here from Monticello. This is total crashes from 2017 to 2022, zoomed in on a particular area. This is Pleasant Street and Highway 42. This is, again, total crashes, a snapshot for 5 years worth of data. I'm gonna just roll through some of these. Here's total crashes looking on the scale there. You can see the red dots will be fatalities. The yellow dots will be the injury A or incapacitating injuries. The three there is the kind of the sea green is the injury B crashes, which are possible injury. injury, and then 2 are the dark blue is possible injury, and then the gray is property damage only. But using this information can really help us identify where our true risks are. Is it behavior? Is it the infrastructure? It is a combination of them. We heard David talk about the Venn diagram. Here's mammocating, looking at injury crashes over the past 5 years, or 2017 to 2021. Wow, those numbers are really popping. For as rural as a county that this is really, something that we need to be diving deeper on. And I know some of you already had, but it's good that everyone knows what is happening, and then we can look for solutions. This is specifically looking at curve crashes. Okay, so some of you might be familiar with that particular roadway, but that is classic. What can we do about that? Do we have curve ahead signs? Do we have chevrons there? Maybe we need some rumble strips. Maybe we need a wider shoulder. That is an opportunity for us to make a difference, is understanding what is going on there and then deploying. You can start with low cost countermeasures. Okay, we're not suggesting to reconstruct the road. We want to start with those low cost countermeasures and make a difference and reduce the number of injury crashes there. Again, more data. This is looking at Thompson, again, more of a larger region here, the fatal and injury crashes. That is too many. And what can we do to bring those down? You can search by, we overlaid the school districts in the state of New York. This is Roscoe School District, looking at the total crashes from 2017 to 2021 in the school district boundary. We drill down a little bit further, we can actually look at Roscoe itself. The school is right here in the middle between the Academy Street and Highland, or one of the schools. Again, if you're looking at safe routes to school, we can take some of this data and information, overlay it with anecdotal information, overlay it with traffic violations, work with law enforcement, work with the school district, work with the community on making our roadways safer. Data is amazing. If you are not a data person, that's okay. There's a lot of people that do dive into data, and making it more accessible and usable, which I think CLEAR has the opportunity to do that for all of us, really allows us to have a better plan and better focus where we might spend our money first. You're going to have countermeasures. Again, we want to solve the problems. We want to understand the problem and the risk, and then deploy proven safety countermeasures. The Federal Highway Administration, as well as the National Highway Traffic Safety Administration, who works very closely with law enforcement, public health, and education. We have a list of low-cost countermeasures. We have a list of countermeasures that we know that can reduce fatalities by 80 to 90%. These are the things that we want to be focusing on and doubling down when we have an opportunity to deploy changes on our infrastructure. There's a great guide for improving pedestrian safety at uncontrolled crossings. That also is going to be a resource that Wanda sends to you. Again, looking at your speeds, looking at your traffic volume, looking at the context. Some people think, oh, we would never do a rectangular rapid flashing beacon in a rural area. And I would disagree. I would say there's opportunities when there's a school crossing. There's opportunities when there's a bus stop. There's opportunities oftentimes to use something that might traditionally be thought that we only use that in urban areas. But we have pedestrians in rural areas. We have pedestrians in small towns. And they have to cross the street, and we want to get them across the street safely. There's example plans from all across the country. I just want you to know that some of those are posted on that local road safety plan DIY site. This is another look at that website. We are updating. We're actually adding a bunch more example plans here in the next week or two. So stay tuned and check that out. We also have state sites that are specific to how to get funding for local agencies to develop plans and implement plans. So those are some examples, and maybe a wish list moving forward. There's Chemung County on the left. You've got Sullivan County on the right. This is just an excerpt from Chemung County's local road safety plan, where they are looking at, on the left there, they're looking at their rural roadways, and they're looking at rural roadways and lane departure. So they have a goal to reduce the crashes of lane departure crashes on rural roadways. On the right, you can see there There is a look at urban. Now urban, I'm going to put quotes on that because Chemung's also not that urban of a county, but there are urban-like or urban-esque areas where they're looking at addressing intersection safety. And there you can see they've highlighted some of the ped and bike issues in red, as well as the older users, okay, at unsignalized intersections. So using that data to make informed decisions can help you spend your money more wisely on locations that have risk, but also have the best potential for solving the problems. And last but not least, I just want to leave a quote from a county engineer from Indiana. This is Kevin Russell. He said, "Someone told me one time the best time to plant a tree was 40 years ago, and the second best time is today." And so to that extent that you can get started and formalize your process of increasing the safety and improving the safety in your county, there's no better time than today. We are all busy. I think that efforts like this, bringing people together, provides us momentum to move things forward as it comes with safety and the health of our communities. I'm going to share just a plug here for a summit that's coming up in September. It's the National Summit on Rural Road Safety. That is in the planning process right now. It might be an opportunity for you to, again, collaborate, talk a little bit more. There are opportunities, again, to work across the country with folks. It is being co-sponsored by the National Association of Development Organizations, which is more of a planning group. So look for more information on that. You can find more information at ruralsafetycenter.org. And I don't think we've got time for this video, but I'll put the link in the chat pod. This is just a quick video looking at local road safety plans and the development of local road safety plans and implementation of local road safety plans from the perspective of local agencies in the state of California. They have gone through Federal Highway Administration and the National Association of County Engineers pilot program for development and implementation. California DOT changed their requirements for highway safety improvement funding after this pilot, and such that local agencies now are required to have a local road safety plan to go after the HSIP funding or the highway safety improvement funding, believing that having a data-driven approach and having a plan to safety is going to get better and more quick results for safety on the roads in California. So with that, please help us get everyone home safely. I know you are all working on that in your different and respective areas, and I want you all to have a safe day.
Only see one question so far, Wanda, in the box. It is, hold on, it went up. There is a question. Oh, wait a minute. Okay, hold on, there's a few. This question is for David from Freda. Can you address how to accommodate walkability on country roads, particularly those where shoulder?
Melinda, I think that was done during David's talk. That was addressed.
Yes, we never.
If
okay. I was gonna, all right, no problem.
Okay, if you want to push back on the expense of his suggestion for filling in the ditches, please go ahead.
I do see one other. Wanda, you tell me what you need to do. I do have some questions in the chat.
So we only have 2 minutes left because it's supposed to be until 12 o'clock. If those that are present have no problem in us going over a few minutes from 12 o'clock, we can address those last questions. Otherwise, I would have to wrap it up right now. Again, it's 11:58 and the webinar is supposed to end at 12. So how does everyone feel about that? Should I wrap it up now or because we can also address those questions later on. We can, with whatever questions are in the chat, we can pass them along to Hillary and David, and then they could be answered
Wanda,
at another time.
I could take a quick stab at Freda's question there, and I can elaborate afterwards for sure.
Perfect. Perfect.
Yeah, and again, I applaud you all. I did hear that you had some funding for the ped and bike or active plan. The key is it's a safety, the plan would be safety focused. And it would have to meet the requirements, again, whatever, it would need to meet the requirements of the criteria for the SS4A funding. So if you have something specific to ped and bike, clearly, if you look at all the implementation, there's a lot of folks that had multidisciplinary for all users in terms of who were successful in getting those grant opportunities. If you are applying for a specific grant, and in this case, SS4A, it would just need to meet all of the criteria that are laid out in the notice of funding opportunity. So we do have some agencies that have complete streets plans that meet all the criteria that are very safety focused. We do know that there's states and local agencies across the country that do have pedestrian and bike safety action plans. And so it would just, through the data, you would need to show that this is the emphasis. The reason you have this emphasis area is because this is your highest risk in your community. And then again, I encourage you to look specifically at what criteria they're asking for. There's equity is a big piece. The disadvantaged communities is a big piece. There's a mention of climate resiliency, collaboration, but key is the data-driven piece, and that it really is a safety planning plan, and that it is acknowledged and recognized by the leadership within your community. So again, I can take additional discussion on that offline, but thank you. I just want to try to get that in there real quick.
Yeah, thank you, Hillary.
And one real quick one, very fast, answering that question, what kind of plan is needed? The better your plan, the more you're gonna be competitive, because it's a competitive grant. So a countywide plan can actually be very effective. In fact, I would start there. You could always go more specific if you need to, but you definitely want to have a plan, because you won't be competitive otherwise. Some are required, but even if it's not required, I'm a firm believer in having a plan.
Okay, so to all our speakers and sponsors, thank you for taking time for your very busy schedule to join us today. We know how busy everyone is. To all who attended, we hope this presentation was useful and that and that you're able to capture elements that will assist in completing successful grant applications for safe routes in Sullivan County. Please look at the PowerPoint and additional information in today's presentations in your email box. If you have any follow-up questions, please don't hesitate to reach out to me through my phone or email. Thank you and have a wonderful rest of the day.
Thank you, everyone. Thank you, Wanda.
You're welcome. Thank you, everyone.
Thank you.
Okay.
Thanks, Wanda.
You're welcome. Bye-bye.
Have a good day.
For you all.
Bye.